Stop memorizing the ABC rule the wrong way. Everyone tells you airway, breathing, circulation, but the Nclex doesn't care about your memorization. It's testing whether you can detect the unstable, life-threatening client first. In this video, I'm showing you the ABC tricks they don't teach in nursing school. When circulation beats airway, when chronic conditions disguise instability, when safety concerns override ABC, and the hidden Nclex traps that make even experienced nurses hesitate. By the end, you'll know exactly how to prioritize in every scenario. No guesswork, no panic, just correct, high-level critical thinking. Let's master the ABC rule like a pro. Question 1. The nurse is assigned 4 clients in the emergency department. Which client should the nurse assess first? A client with COPD with oxygen saturation of 88% on 2 liters nasal cannula and baseline dyspnea. B, a client with sudden onset hoarseness and difficulty swallowing after eating shellfish. C, a client with heart failure reporting 3+ bilateral pitting edema. D, a client with chronic atrial fibrillation with heart rate of 110 beats per minute. Answer: B, a client with sudden onset hoarseness and difficulty swallowing after eating shellfish. Rationale: this suggests acute airway edema from anaphylaxis. Airway obstruction is an immediate life threat. COPD with 88% may be baseline. Chronic AF and edema are stable findings. Question 2. Which client should the nurse see first? A post-op thyroidectomy client with tingling around the mouth. B, a client with RR 8 breaths per minute after morphine administration. C, a client with BP 88/60 after antihypertensive medication. D, a client with chest tube drainage of 100 milliliters in 4 hours. Answer: B, a client with RR 8 breaths per minute after morphine administration. Rationale: respiratory depression is immediate breathing compromise. Hypotension is concerning, but not as immediately fatal as inadequate ventilation. Question 3. The nurse is caring for 4 clients. Which requires immediate intervention? A client with tracheostomy who is able to speak clearly. B, a client with asthma who has audible wheezing. C, a client with sudden absence of breath sounds on one side. D, a client with oxygen saturation 92% on room air. Answer: C, a client with sudden absence of breath sounds on one side. Rationale: absent breath sounds may indicate tension pneumothorax, life-threatening airway or breathing collapse. Wheezing means air is still moving. Question 4. Which finding requires immediate priority? A, hemoglobin 8 grams per deciliter. B, new confusion in a client with sepsis. C, urine output 40 milliliters per hour. D, temperature 38.2 degrees Celsius. Answer: B, new confusion in a client with sepsis. Rationale: new confusion signals worsening perfusion and hypoxia to the brain. Acute change beats stable anemia or mild fever. Question 5. Which post-op client should the nurse assess first? A, SpO2 90% 12 hours after surgery. B, sudden stridor after neck surgery. C, pain score 8/10. D, BP 150/88. Answer: B, sudden stridor after neck surgery. Rationale: stridor equals upper airway obstruction, immediate airway emergency. Question 6. A, GI bleed with BP 84/50. B, COPD O2 sat 89% baseline. C, post-op nausea. D, blood glucose 250 milligrams per deciliter. Answer: A, GI bleed with BP 84/50. Rationale: Circulatory collapse from hemorrhage overrides chronic oxygen issues or hyperglycemia. Question 7. A. Seizure actively occurring. B. Post-ictal sleeping. C. Headache 6/10. D. BP 140/90. Answer: A. Seizure actively occurring. Rationale: active seizure compromises airway and safety immediately. Question 8. A. Pulseless electrical activity. B. HR 120 sinus tachycardia. C. SpO2 94%. D. Anxiety. Answer: A. Pulseless electrical activity. Rationale: no pulse equals immediate CPR. Question 9. A. Chest pain 2/10. B. Crushing chest pain with diaphoresis. C. Stable angina relieved by rest. D. Heartburn after meal. Answer: B. Crushing chest pain with diaphoresis. Rationale: acute MI signs equals circulation emergency. Question 10. A. Talking in full sentences with asthma. B. Silent chest and no wheezing. C. Mild accessory muscle use. D. O2 sat 95%. Answer: B. Silent chest and no wheezing. Rationale: silent chest equals severe airway obstruction. Question 11. The nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with pneumonia who has crackles in the lower lobes and oxygen saturation of 93% on 2-liter nasal cannula. B. A client with a pulmonary embolism who suddenly reports sharp chest pain and dyspnea. C. A client with chronic heart failure who gained 2 pounds overnight. D. A client with asthma requesting a scheduled nebulizer treatment. Answer: B. A client with pulmonary embolism who suddenly reports sharp chest pain and dyspnea. Rationale: sudden chest pain and dyspnea in PE suggest acute worsening and potential respiratory collapse. This is an immediate breathing circulation threat. The others are stable or expected findings. Question 12. Which client should the nurse prioritize? A. A client with DKA whose blood glucose is 420 milligrams per deciliter. B. A client with a potassium level of 6.5 milliequivalents per liter and peaked T waves on ECG. C. A client with sodium 130 milliequivalents per liter. D. A client with chronic renal failure scheduled for dialysis. Answer: B. A client with potassium level of 6.5 milliequivalents per liter and peaked T waves on ECG. Rationale: severe hyperkalemia with ECG changes can cause fatal arrhythmias. Circulation instability overrides hyperglycemia and chronic conditions. Question 13. The nurse is caring for 4 clients. Which client requires immediate assessment? A. A client 2 days post-MI reporting fatigue. B. A client with chest pain rated 4/10 relieved by nitroglycerin. C. A client with sudden hypotension and muffled heart sounds after cardiac catheterization. D. A client with atrial fibrillation and heart rate of 102 BPM. Answer: C. A client with sudden hypotension and muffled heart sounds after cardiac catheterization. Rationale: this suggests cardiac tamponade, a life-threatening circulatory emergency. Immediate intervention is required. Question 14. Which client should the nurse see first? A. A client with RR26 and audible wheezing. B. A client who is anxious and hyperventilating. C. A client with opioid toxicity and pinpoint pupils who is difficult to arouse. D. A client with chronic bronchitis and productive cough. Answer: C. A client with opioid toxicity and pinpoint pupils who is difficult to arouse. Rationale: opioid toxicity leads to respiratory depression and airway compromise. Breathing failure is the priority. Question 15. The nurse is assigned 4 clients. Which client is the priority? A. A client with GI bleeding and black tarry stools. B. A client with active bright red hematemesis and BP 86/48. C. A client with nausea and vomiting. D. A client with heartburn after meals. Answer: B. A client with active bright red hematemesis and BP 86/48. Rationale: active hemorrhage with hypotension indicates circulatory collapse. Immediate intervention is required. Question 16. Which client requires immediate intervention? A. A post-op client with oxygen saturation 91% on room air. B. A client with stridor after extubation. C. A client with temperature 38.5 degrees Celsius. D. A client with mild incisional pain. Answer: B. A client with stridor after extubation. Rationale: stridor indicates upper airway obstruction. Airway emergencies take absolute priority. Question 17. The nurse is caring for 4 clients. Which client should be assessed first? A. A client with sepsis and urine output 20 milliliters per hour. B. A client with chronic kidney disease and creatinine 3.0 milligrams per deciliter. C. A client with hypertension 160/90. D. A client with fever 38.1 degrees Celsius. Answer: A. A client with sepsis and urine output 20 milliliters per hour. Rationale: low urine output in sepsis indicates worsening perfusion and possible septic shock. Circulatory instability is priority. Question 18. Which finding requires immediate follow-up? A. A client with stroke who suddenly develops difficulty swallowing. B. A client with stroke with residual weakness. C. A client with headache 5 out of 10. D. A client with BP 150/90. Answer: A. A client with stroke who suddenly develops difficulty swallowing. Rationale: new dysphagia increases aspiration risk and threatens airway. Acute change overrides chronic deficits. Question 19. Which client should the nurse see first? A. A client with chest tube drainage of 50 milliliters in 1 hour. B. A client with sudden tracheal deviation and severe dyspnea. C. A client with productive cough. D. An oxygen saturation 94%. Answer: B. A client with sudden tracheal deviation and severe dyspnea. Rationale: tracheal deviation suggests tension pneumothorax, a life-threatening airway and breathing emergency. Question 20. The nurse is caring for 4 clients. Which client is the priority? A. A client with new onset confusion and blood glucose 38 milligrams per deciliter. B. A client with hyperglycemia 320 milligrams per deciliter. C. A client with chronic dementia. D. A client requesting pain medication. Answer: A. A client with new onset confusion and blood glucose 38 milligrams per deciliter. Rationale: severe hypoglycemia can rapidly cause neurologic damage and death. Immediate correction is required. Question 21. The nurse is assigned 4 clients on a medical surgical unit. Which client should the nurse assess first? A. a client with COPD whose oxygen saturation is 90% on 2-liter nasal cannula and states this is baseline. B, a client 1 hour post-bronchoscopy who reports increasing throat tightness. C, a client with heart failure and 2+ peripheral edema. D, a client with pneumonia and temperature of 38.3 degrees Celsius. Answer: B, a client 1 hour post-bronchoscopy who reports increasing throat tightness. Rationale: throat tightness after bronchoscopy suggests airway edema and possible obstruction. Airway compromise overrides chronic hypoxia and stable findings. Question 22. Which client should the nurse see first? A client with diabetic ketoacidosis and Kussmaul respirations. B, a client receiving heparin with sudden onset severe headache. C, a client with blood glucose of 280 milligrams per deciliter. D, a client with chronic hypertension 170/96. Answer: B, a client receiving heparin with sudden onset severe headache. Rationale: sudden severe headache on anticoagulation suggests intracranial hemorrhage. This is an immediate circulation emergency affecting brain perfusion. Question 23. The nurse is caring for 4 post-operative clients. Which client requires immediate assessment? A client with abdominal distension 24 hours after surgery. B, a client with oxygen saturation 95% on room air. C, a client with sudden shortness of breath and HR 128 BPM. D, a client requesting pain medication. Answer: C, a client with sudden shortness of breath and HR 128 BPM. Rationale: sudden dyspnea and tachycardia suggest pulmonary embolism. Acute breathing compromise takes priority. Question 24. Which finding requires immediate intervention? A client with pancreatitis reporting severe abdominal pain. B, a client with blood pressure 88/54 after spinal anesthesia. C, a client with nausea after opioid administration. D, a client with mild incisional drainage. Answer: B, a client with blood pressure 88/54 after spinal anesthesia. Rationale: hypotension after spinal anesthesia indicates possible circulatory collapse. Circulation instability overrides pain and nausea. Question 25. The nurse receives report on 4 clients. Which client should be assessed first? A client with asthma who is restless and has difficulty speaking full sentences. B, a client with chronic bronchitis with productive cough. C, a client with oxygen saturation 93%. D, a client requesting scheduled inhaler. Answer: A, a client with asthma who is restless and has difficulty speaking full sentences. Rationale: inability to speak full sentences and restlessness indicate worsening airway obstruction. This suggests impending respiratory failure. Question 26. Which client is the priority? A client with new onset atrial fibrillation and BP 78/42. B, a client with controlled atrial fibrillation and HR 98 BPM. C, a client with palpitations but stable vital signs. D, a client with chronic heart murmur. Answer: A, a client with new onset atrial fibrillation and BP 78/42. Rationale: hypotension with dysrhythmia indicates unstable circulation. Immediate intervention is required. Question 27. The nurse is assigned 4 clients. Which client should be seen first? A client with seizure disorder who reports aura. B, a client actively vomiting bright red blood. C, a client with migraine headache. D, a client with chronic anemia and fatigue. Answer: B, a client actively vomiting bright red blood. Rationale: active hematemesis indicates acute hemorrhage and potential circulatory collapse. Immediate priority. Question 28. Which client requires immediate intervention? A client with head injury who becomes increasingly drowsy. B, a client with chronic confusion. C, a client with mild headache. D, a client with BP 150/88. Answer: A, a client with head injury who becomes increasingly drowsy. Rationale: increasing drowsiness suggests rising intracranial pressure and decreased cerebral perfusion. Acute neurologic deterioration is priority. Question 29. Which client should the nurse assess first? A client with pulmonary edema and pink frothy sputum. B, a client with peripheral edema. C, a client with chronic cough. D, a client with stable angina. Answer: A, a client with pulmonary edema and pink frothy sputum. Rationale: pink frothy sputum indicates acute pulmonary edema and severe breathing compromise. Immediate intervention required. Question 30. The nurse is caring for 4 clients. Which client is the priority? A client with sudden onset severe abdominal pain and rigid abdomen. B, a client with constipation. C, a client with nausea after chemotherapy. D, a client with heartburn. Answer: A, a client with sudden onset severe abdominal pain and rigid abdomen. Rationale: rigid abdomen suggests perforation or peritonitis, which can rapidly lead to shock. Circulation and systemic compromise take priority. Congratulations! Now you see why the Nclex doesn't just test memorization. You've learned how to spot the unstable client, detect hidden traps, and prioritize like a pro. If this video helped you think smarter and faster, drop a comment saying, "I think like the Nclex now." And don't forget to subscribe to MCQs Master 101 for more videos that break down every tricky, high-yield concept that instructors don't teach. Remember, the exam doesn't wait. Your critical thinking must be faster than the scenario. See you in the next video.